All right. We decided we had to sit down and talk immediately. We just returned from the Breathing and Wellness Conference where we listened to an incredible electrophysiology cardiologist by the name of Dr. Paul Nguyen. And we had to get in here immediately. This is Monday morning, returning from the conference to tell you guys what we learned and how it's going to impact your life and our practices as we continue to save lives by making sure you have oxygen at night.
And this is much more than expanding the arches, because that is the unit of measure we look at, like how wide did we get? And it's really interesting when he put forth the challenge to the dentist to do better in their practice by identifying this at a minimum. And in our practice, you've been doing this since 2019. So it's really cool. We actually have some data on this.
Lots.
And I actually, from Mexico, reached out to my team here in Texas, and I wanted some of this information because we're a good dental office and we take blood pressure at every appointment. And so we have this information. So I was curious and I had him go back through, and I won't share all the details on here now, but if you want to talk about having an impact on someone's life, and one patient came to mind, and he showed up with for his records appointment after being a patient here for a very long time. At his records appointment, his blood pressure was 175 over 114. And
that's horrible, guys.
He went into adult non-surgical expansion therapy with Cali. Treatment lasted 16 months. His symptoms improved, but his arch width only gained 1.2 millimeters. And if we're looking just at arch width, and this is something you've talked about in the past where you don't treat to numbers.
Absolutely.
And if you're treating to an arch width number, you might be missing a big part of what's going on in the patient's health, because he went from 175 over 114 to 131 over 81. Now that's still stage 1 hypertension, but can you imagine the amount of pressure and that his organs are no longer feeling?
Getting out of almost hypertensive crisis.
Yes.
Right. On a regular basis.
And so you
guys need to be looking at this. You need to be taking your patient's blood pressure, especially your sleep patients. And if you have a patient who has uncontrolled hypertension, they need a sleep study. I tell doctors I train all the time, have your patients take their blood pressure the first minute they wake up. You want to make sure that it is low when they wake up. You are in REM sleep before you wake up. That is the second half of sleep. If you've made it into REM sleep, that is when you're paralyzed. That is when your apneas are going to be the worst. And that is when your body's going to be struggling the most right before you wake up. It's typically when people pass away with sleep apnea. You want to know that your hypertension is controlled, especially need to take it in the morning.
And Dr. Nguyen, this is for you, Callie. What do you say when I say diabetes?
Heart disease.
That's right. 1 and 1. They go together. So I can't thank you enough, Dr. Nguyen. It was so much fun to listen to you talk, listen to you educate a room full of dentists who are already interested in this. And I can't believe how mind blown I was after listening to so many others in traditional healthcare talk about this. So you've definitely given us a challenge, and we accept, and we also are excited to see what kind of impact we can have in our communities, not just here, but we might try to take it a little bit bigger.
Absolutely. We can't wait, guys. So y'all got to be paying attention to that. We're so thankful to Dr. Nguyen for literally putting the pressure on. He looked at a room of 200 dentists and said, you're failing. You all suck at this. You're not doing enough. And by the time the patient's on my chair with their chest open, getting defibrillators and different things placed in their chest, we have failed.
Yeah. All right. More on this soon. Bye.